The high-level advocacy mechanism is designed to find new ways of addressing a growing drug epidemic in the region. In recent years, the volumes of heroin shipped from Afghanistan via Pakistan along a network of maritime ports to Eastern and Southern Africa appears to have increased drastically. While most of this is destined for the Western market, there are worrying signs of a great increase in local consumption. As a member of the Global Commission on Drug Policy, Motlanthe will chair the new commission.
And we hope that this commission will be able to mobilize communities across the region and secure commitments from governments in a way that would give voice and space of participation to key communities who, given the criminalization and prohibition of drug use, has resulted in human rights of even children and young people being violated.
The Commission will play a key role in reviewing and assessing the impact of existing policies across the region, with recommendations for more evidence-based policies. The prohibition of drugs is not necessarily viewed as aiding in diminishing consumption.
The Global Commission takes the view that prohibitionist approach was always bound to fail. Throughout human history, human beings have reached for some kind of substance for whatever reason. And we have found ways in so many of our societies now to regulate drugs which really are or can be quite harmful, like tobacco and alcohol. And we need to start drawing on those experiences of legal regulation as we look at how to map a way forward for reform with the currently illicit drugs. There is a great deal of momentum around the world on drug law reform. Won't go into detail in these opening comments, but it ranges from wide-ranging decriminalisation and an emphasis on massive harm reduction. And of course, in some countries now, like Canada and Uruguay, a full legalisation for cannabis and legal markets created.
Southern and Eastern Africa accounts for 60% of global HIV infections. Increased substance abuse also sees an increase in injection transmissions in the region.
This is a multifaceted problem. As you will hear, it's not just an issue for the Eastern Southern African region, but globally what we've been seeing is increase in drug consumption in very complex ways with many ramifications at a community level. And it's not something that can be solved by one entity or one ministry. And I think we have humility to appreciate that this is the beginning of a journey, but I hope that we can, with partnerships with civil society, key stakeholders, and working across different departments, but also sharing good practices between regions, between countries, that we can accelerate and start to see the light at the end of the tunnel.
The Eastern and Southern African Commission on Drugs will also, among others, focus on establishing priority areas for action. Mariska Botha, SABC News, Cape Town.